So, the title of my presentation is Radiesse Vs Belotero. Where, when, and why should we be using one instead of the other? So aging is a very complex process involving all the tissues, all the layers, all the anatomical structures of the face, and showing many different signs and clinical features. That's why we can't rely on one single tool to get good outcomes, but necessarily we have to combine several different procedures and tools. From this point of view, Radiesse on one hand and Belotero Portfolio HAs represent the perfect combination to fully and effectively treat aging. But the question at this point is, what tool and for what? And what's our aim? What's the aim of our treatment? In my opinion, the purpose of our treatment strategy should be to restore natural and youthful beauty. When a patient comes in, what he or she usually asks for is to just look fresher and a little bit younger and more relaxed, like going back to his or her phase of some years before. And most of all, our patient doesn't want to look overdone, nor fake, nor unnatural. So they just want to look natural. And that's why to maximize our outcomes and achieve the highest patient satisfaction, I think that it's essential to get a thorough and comprehensive understanding and knowledge of two things. First one is the anatomy we're dealing with, and the second is rheology. So one of the main clinical features of the aging is that we change our face in our shape and contours, meaning that the V shape that is typical of a young face progressively becomes an inverted T, because we lose volume and our tissues just slide downwards, becoming sagging and drooping. So if we divide the face into three vertical sectors, S1, S2, S3, we can see that S1 and S3 are relatively fixed, so they don't move, while the S2 sector, which lies in between, is relatively mobile. So with aging over time, it slides downwards, thus forming the jowling. So this heaviness in the patient's jawline. And this is one of the target of our treatment, of course. With aging, also the bone does age because it undergoes a gradual resorption process. And the areas of the facial skeletal which are affected the most by resorption are, number one, the orbits, which get elongated because they lose volume in their upper medial corners and lower lateral corners, so they get a lengthening. And number two, the piriform that gets wider in width and gets a retrusion. And number three, severe maxillary atrophy, so also the maxilla gets a retrusion. And number four, atrophy of the mandible. According to these findings, Lambers postulated his theory of the clockwise rotation of the facial skeletal of the midface relative to the cranial base. Also, the retaining ligaments of the face undergo some degrees of aging, but it is thought actually that with aging, retaining ligaments don't age themselves, but they develop an increasing laxity and so a decreasing strength in their supporting function because of bone resorption. So because of the fact that we lose bone, so we have this process of bone remodeling, What changes is the retaining ligaments anchor points, so they're firm adhesion to the bone. That's why they develop an increase in laxity. And at the same time, facial compartments get expanded, thus resulting in bulging and sagging of the soft tissue. Just to quickly remind to you, the main retaining ligaments that are interesting for us are in the forehead, so upper third, the superior temporal septum along the temporal fusion line, and inferior temporal septum. The orbicularis retaining ligaments along the orbit. And then you have the zygomatic cutaneous ligament or McGregor's patch in its lateral thickened part. And then you have the mesenteric cutaneous ligament or deep lateral septum. And then the maxillary cutaneous ligament or medial cheek septum, and the mandibular ligament at the level of the pre-jaw sulcus. And it's also important to know the anatomy of the fat compartments of the face, which can be divided into deep and superficial according to their position relative to this mass. They were first described by Rorik and Pessa. The deep fat compartments lie just beneath, so below this mass layer, so they are deep. And they are the medial sousp, the lateral sousp, and the deep medial cheek fat compartment, and the buccal or Bichat fat compartment, which is a large, big fat compartment extending from the temple up to the mandibular angle, and its inferior part contributes to the formation of the jowling when it falls down. Superficial fat compartments, so above the mass layer. So they are in the forehead, you have one central, two middle, and one, it's not that visible here anyway, lateral orbitals, which is in between the temporal septum, and then you have in the midface the nasolabial, the inferior orbital, and the three superficial cheek fat compartment, which are the medial, the middle, and the lateral temporal. Very, very tall, very high. So from the temple up to the mandibular angle. And then you have superior jowl, inferior jowl, and you have the chin and lip fat compartments, which do age as well. So chin fat compartment very quickly, as well as superficial and deep. So superficial, you have very easy, medial, middle, and lateral. Deep, you have the submental and the deep lateral. The deep lateral contributes together with the next one we're going to see, the lateral. So deep lateral on one hand, lateral lower lip. When they lose volume, they contribute to the formation of the marionette line, okay, because there is a lack of support to the corners of the mouth. So here you have the lip fat compartments. Very quickly in the upper lip, you have two central, two lateral, two superior, two lateral inferior. Here you have in between these two lateral and lateral inferior a wrinkle. It's very visible on myself. You can have a look later if you want. And you have an ascending artery running right here. In the lower lip, you have one central, two middle, and two lateral. So we have seen the anatomy very, very quickly at a glance. Rheology, but we have seen very, very well by my colleagues. So very, very quickly, of course, to get the best results possible, you have to know very well rheology of your fillers. So you have to know very well the characteristics of your tools, of the tools you're going to use. So elasticity, what is elasticity? Is a gel's ability to push back against a force that has been applied to it. A force like, for example, compression or shear force, for example, facial movements or scale laxity or gravity are examples of these kinds of force. But elasticity also deals with the capacity of the gel to resume its original shape, so getting back in shape like a spring. So high elasticity gel means high lifting support, high capacity of projection and volumize. For example, radius, volume, and intense are all high elasticity gel. Viscosity deals with fluidity and spreadability. So it's the gel's ability to resist shear forces during and after injection. So during injection, it's fluidity. So it's the extrusion force, the force you have to apply to make your filler pass through your needle. And spreadability is the capacity of the filler to resist shear forces after injection, so to spread or not to spread into surrounding tissues. So high viscosity gel, for example, volume, intense, and radius, they are relatively hard to push through the needle, except volume, which is a medium viscosity. But after injecting, they don't move. They just stay where you put them. They give you what you see. This is what you get result. On the contrary, low viscosity gel, balance or soft, they are quite softer to make them pass through the needle, and after injection they migrate and spread quite easily. Cohesivity is the ability of a gel's molecules to stick together, and this is because of their intrinsic affinity. So cohesivity deals with the gel's structural integrity. So high cohesivity means high tissue integration, high so even distribution and less surface irregularities. All Belotero HAs are high cohesivity gels because of their CPM, cohesive polydensified matrix technology. Plasticity deals with malleability, is the capacity of a gel to be shaped after injection. And the best plasticity gel for sure is Belotero volume. So let's resume. So radius and volume, high elasticity, so high lifting capacity. Both high viscosity, so high viscosity especially for radius, so it doesn't move, stays where you put it. Medium viscosity for volume because it can easily pass through the 30 gauge needle. And volume, high plasticity, so smooth transition between treated and untreated areas, and high cohesivity, of course. So going to the intense and balance. Intense, high elasticity, like volume, like radius, high lifting support. Balance, low elasticity. Intense, high viscosity is the one with the highest viscosity. So high tissue support, it stays where you put it, and balance, low viscosity, and both high cohesivity. And the soft, like balance, low elasticity, so no lifting, low viscosity, so spreads easily and soft to push, and high cohesivity. The balance and the soft are those with the highest cohesivity. And finally, the hydro, which is a non-cross-link HA, 80 milligrams per ml, that has been mixed with 21 milligrams per ml of glycerol to improve its capacity of attracting water. So it's been designed to hydrate, to be a biostimulator, to improve skin texture. So now let's have a look at some clinical cases to understand how we can make our treatment strategy. So look at this lady. She has volume loss in her mid-face, in her medial soothe, and also deep medial, and also in her superficial cheek fat compartments. She has loss of projection of her zygoma. She has retruded chin, And she has, of course, visibility of hair, nasolabial folds, and marionette. She has a severe jowling and pre-jowl sulcus. What did I do on her? I did volume to improve the projection of hair, zygoma and chin, and to I injected some volume also in hair medial soothe to improve hair lid-cheek junction and to correct hair tear trough deformity. Then radius to lift, so because it's the one with the highest elasticity, radius. So I injected it into hair superficial fat compartments, so the medial, the middle, and the lateral temporal cheek, and also in hair pre-jowl. I like injecting radius for contouring, and this is a matter of contouring. On the contrary, when I want to give support, I prefer a higher elasticity, a volumizing filler like volume or intense. That's why I've been using intense to give support to the corners of her mouth, so for the top of her marionette, and also for hair to target her nasolabial folds. And then I did some balance to define her vermilion borders, and finally some soft for hair perioral wrinkles and crow's feet. And this is hair before and after. Another case, so this lady, she has, as you can see here, she has volume loss in her medial soothe and severe tear trough deformity. She has some mid-face volume loss. She has some heaviness in her jawline, marionette, and also some damaged skin, so some sun-related wrinkles of her skin. So what I did on her, I did some volume for her medial soothe and to improve the projection of her zygoma, and then radius to lift hair tissues up, always in the superficial cheek fat compartments, and then the balance to target hair cheek wrinkles and soft perioral wrinkles and crow's feet. And this is hair before and after. Another case, this is a very empty face, so she's got a severe lack of volume in her medial soothe and deep medial cheek. So this is one of the deep fat compartments, and you can see very well because you have a hollow here between the malar mound. This is the inferior orbital fat compartment that is superficial, and the nasal area. So here you have a hollow, and this is because of the lack of volume of your deep medial cheek. And you have also a sagging tissues, jowling, pre-jowl, marionette, and also some deficiency in her temporal fossa. What I did on her, I did volume, of course. She needs volume here and on her temple to lift her eyebrow tail a little bit up. And then, of course, she needs to be lifted up with radius, so always in the same fat compartment, superficial, and also for hair pre-jowl. And this was radius plus pure. On the contrary, on the neck, it was radius without lido, mixed 1-to-1 with lidocaine as a biostimulator, so to improve the skin texture of her neck. And Belotero intense, nasolabial folds and the top of the marionette, and balanced vermilion borders and hair cheek wrinkles. And always soft for hair tear trough and crow's feet and perioral wrinkles. And this is hair before and after. Another case, so this is not an empty face, actually. On the contrary, she has quite a heaviness in her mid-face because of the hypertrophy and ptosis of her nasolabial fat compartment. And so we have to lift this part up as much as possible without making it get worse, okay? So what I did on her, I did volume on her temple and also on her lateral soothe. So don't inject superficial in the malar mound hyaluronic acid because it's gonna get worse. It's gonna give you swelling, edema. But this was a deep injection, okay, on the bone because you wanna improve the projection of your zygomatic arch and you want to lift your heavy nasal labial fat compartment up. And also I inject some volume on her labiomental crease because with aging you can see that the chin is shortening and is losing projection, and it also rotates. It's rotating upwards and backwards. So to make the chin rotate again, like in the young face, downwards and backwards, I injected some volumizing filler here. And then radius, as in the previous case, and the intense, also to give a little bit of projection to her lips, and vermilion border with the balance. And then also a little bit of soft crow's feet and perioral wrinkles. And this is hair before and after. Another case, so another empty face. So lack of volume here, as in the previous case, and nasolabial folds, and heaviness, and loss of definition of her jawline, and sad and tired eyes. Okay, so what did I do? Volume in her mid-face to restore her volume here, temples, labiomental crease, and then radius as in the previous case, except that I injected a little bit more posteriorly because she has kept a good volume in her medial superficial cheek compartment, and then intense as in the previous case, and balanced vermilion borders. And this is hair before and after. Last case, I think. So young lady is in her 40s, so she shows some early signs of aging because she has lost some volume here, and she starts having some heaviness here, and she's got retruded chin. So I did volume to improve the projection of her zygoma and the chin, medial soothe, and to reshape her chin. So I injected, I think, 3 syringes, 3 or 4, I don't remember, of Belotero volume to improve the projection of the chin, a lot of volume here, so 1 full syringe in her labiomental crease to make it rotate downwards and to support the corners of the mouth. And now radius to lift the tissues up, balance for her cheek wrinkles, and this is hair before and after. So next one, this is to say medical profiloplasty, because this young lady was concerned about her profile view, so she didn't like how she looked with this profile. So what I did on her was to reshape her nose and her chin just by using Belotero volume. So when you want to reshape the profile of your patient, you have to use, of course, a high elasticity gel, like volume or intense, for example. And I prefer to use volume or intense to do this, to accomplish this job, because they're volumizer. Radius is less volumizer, so that's why I prefer using them instead of radius. And so I injected in her glabella and in her supratip to conceal her dorsal hump, and also a little bit here in her nasal spina to make the tip rotate a little bit upwards. And of course, I added some projection to her chin. And this is hair before and after. So very quickly, let's have a look to Radiesse for hand rejuvenation. So why should we be using Radiesse to rejuvenate the hand? Because of course, with aging, hands get skeletonized. So of course, they lose volume, they lose subcutaneous tissue, and dorsal veins and extensor tendons get more visibility. So you have an empty and oldish looking hand. And Radiesse has, of course, an FDA approval for hands rejuvenation, and it's excellent for this purpose because as it is whitish, it can conceal very well the bluish color of your dorsal vein. So what's the right plane, what's the right layer to inject? It's the loose areolar tissue between the superficial and the intermediate fascia of your dorsal hand. Right the layer where the dorsal veins run, okay? And this is exactly this layer between these two fascia. You can choose between two techniques. So the technique with a cannula with one proximal entry point and 2 or 3 distal entry points by using at least a 25 gauge diameter, 50 millimeters length cannula. This is my favorite technique. Or you can use the bolus. The technique with the bolus, I've never used it, was firstly described by Busso and Applebaum. So I put these 2 papers about Radiesse for hand rejuvenation. It's a very good option you can offer to your patient because, as you can see, you can, of course, restore the volume loss, and because of the collagen and elastin production, you can, of course, improve also the skin texture of the hand. You can see very well how dorsal veins are concealed, are hidden by the product. Another case, before and after. Okay, the last topic, Radiesse for neck and décolletage rejuvenation. So I put these 2 papers that have been published on peer-reviewed journals. So the first one by Yuskoskaya about the improvement of skin thickness and quality and collagen and elastin production by using diluted Radiesse for neck and décolletage. And this very interesting and more recent paper by Gabriela Casabona, based on the combination between microfocus ultrasound, so Ulthera, and diluted Radiesse for rejuvenation of neck and décolletage. And she has very, very good result by using this combination. And this is some cases of mine. I've never used this combination, so I just use diluted Radiesse 1:1, diluted with lidocaine, so 1.5 cc of Radiesse without lido and 1.5 lido, okay? 1% or 2%, doesn't matter. And the last case, and I think I'm done. This is because I spent 1 year of my residency in southern Germany. It was near Rosenheim. And, at that time, it was many, many years ago, I could speak German a little bit. Now I've forgotten almost everything. But I hope it was helpful for you anyway. And thank you for your kind attention.